There is something you may have been doing for weeks, months, even years, without ever understanding why it is not working. You wake up in the morning after 7 or 8 hours spent in bed and you feel exhausted. Not tired the way you feel after a good day of work. No. Exhausted in a different way, hollow, as if something inside you never really had the chance to rest. And perhaps every night it is the same story. You fall asleep easily enough, but 2 hours later, or 3 hours, or even at a fixed hour like an alarm nobody programmed, something wakes you up, and you have to get out of bed. Not because you are in pain, not because anything hurts, just because your body is sending you a signal you cannot ignore. And when you come back to lie down, sometimes sleep returns quickly, sometimes it takes an hour to come back, and sometimes it simply does not come back at all. You have tried drinking less in the evening. You may have even stopped water after 6 in the evening, going to bed slightly dehydrated in the hope that it would change something. You have tried going to bed earlier or later. You may have tried herbal teas, warm milk, sleeping pills, and despite all of this, you find yourself standing in the dark hallway in the middle of the night, wondering if this is truly what aging means, if it is permanent, if it is going to get worse. Today, I want to talk to you about a mechanism that conventional medicine rarely explains to patients over 60, because there is no medication to prescribe to correct it, and appointments move too quickly to address this kind of subject in depth. I am going to show you why disrupted nights almost never come from where you think they do, and I am going to give you a concrete, verifiable approach that thousands of elderly people are already using with real progressive results. Hello, I am Dr. Hillman, a physician specializing in preventive health for seniors. For many years, I have accompanied men and women who arrive in my office with the same words, the same circles under their eyes, the same weariness in their voice. They all say the same thing. They have tried everything. They are beginning to accept that their body is broken. And I tell them each time the same thing I'm going to tell you today. The body is not broken. It is dysregulated. And things that are dysregulated can be recalibrated, provided you understand what happened and act in the right place. What you are experiencing has a medical name. It is called nocturia, from the Greek for night and urine. It is the need to get up at least once per night to urinate, with a direct consequence of sleep disruption. Studies estimate that more than 60% of people over 60 suffer from this phenomenon to varying degrees. What is striking is that this statistic is often presented as an inevitable consequence of aging, when in fact it conceals a biological reality that is far more interesting and, above all, far more modifiable than we think. Most people, and many general practitioners who lack time, attribute this problem to two very simplistic causes. First, urine production would increase at night. Second, the bladder ages and can no longer hold as long. Both of these statements contain a grain of truth, but they are incomplete to the point of leading people toward solutions that do not work. And when solutions do not work, people accept resignation as the only possible outcome. I want to explain the real mechanism to you with an image you will understand immediately. Imagine you have an alarm system in your home. This system is normally calibrated to trigger only in the event of genuine danger. But if the sensors have become too sensitive, if the battery is low, if the electrical signal is unstable, the alarm can go off for anything at all. The wind, a fly, a slight temperature change. And you get up in the middle of the night to check. You find nothing. You go back to bed, and an hour later, the alarm sounds again. The problem is not that someone is trying to break in. The problem is that the detection system itself is miscalibrated. This is exactly what happens in your nervous system at night. When sleep is truly deep, the brain does something extraordinary that neurophysiologists call nocturnal inhibition of non-urgent signals. In simple terms, in deep sleep, the brain decides to mute all signals that are not a genuine emergency. The bladder may contain a little urine. The brain knows this. But in a state of healthy deep sleep, it essentially says, "Not yet. This is not urgent. We are sleeping." And you continue sleeping until morning. This is what happened when you were 40 years old. This is what can still happen. But for it to happen, the brain needs a particular fuel. And this fuel, in many elderly people, is insufficient. I am speaking of vitamin B1, also known by its scientific name thiamine. Before you get the impression that I am offering you a solution too simple to be true, let me explain precisely why this nutrient is central to this mechanism and why its deficiency goes unnoticed in routine health tests. Thiamine is what biochemists call an enzymatic cofactor. Concretely, it is a key the nervous system needs to produce cellular energy efficiently. But its most relevant role for what interests us here is its direct involvement in the synthesis of GABA, which is the brain's primary inhibitory neurotransmitter. If you have never heard of GABA, think of it as the braking pedal of your nervous system. Without sufficient functional GABA, the nervous system cannot decelerate at night. It remains in permanent surveillance mode. It remains sensitive to everything. And this nocturnal hypersensitivity turns the slightest sensation into an emergency signal. When the nervous system is in surveillance mode, a half-full bladder seems full. A slight shift in position during sleep seems urgent. A distant sound from the street becomes a wake signal. The whole body is on low-level alert at all times, even if you are lying down, eyes closed, convinced you are sleeping. This is not real sleep. It is slowed wakefulness, and in this state, the slightest signal crosses the threshold of awakening. Why does vitamin B1 decline in elderly people without anyone noticing? There are 4 mechanisms that often accumulate simultaneously. First, with age, the mucosa of the small intestine progressively reduces its ability to absorb water-soluble vitamins, and thiamine is among the vitamins most affected by this phenomenon. You can eat normally, appear to have a balanced diet, and yet absorb significantly less vitamin B1 than a 40-year-old eating exactly the same thing. Second, regular coffee consumption, even moderate, depletes thiamine reserves because caffeine accelerates its urinary elimination. The after-lunch coffee, the habit many consider harmless, silently contributes to emptying reserves night after night. Sugar does the same through a different mechanism, because glucose metabolism consumes thiamine, and the more fast sugars you consume, the greater the demand for thiamine. Third, and this is the point no one ever mentions in medical offices, certain medications very common in the elderly directly increase urinary excretion of thiamine. Loop diuretics, such as furosemide, often prescribed in cardiology, eliminate thiamine in the urine in a measurable way documented in scientific literature. A study published in the Journal of the American College of Cardiology in 2006 showed that up to 33% of patients treated with furosemide long-term showed biological signs of thiamine deficiency without it ever being searched for or detected in routine follow-up. Fourth, the standard blood test to measure thiamine is simply not included in routine checkups. Doctors measure cholesterol, blood sugar, creatinine, liver enzymes, but thiamine is rarely requested except when severe neurological diseases or chronic alcoholism are suspected. The deficiency can therefore install itself over years, gradually, without ever triggering a medical alarm. I would like to tell you about a patient I followed some years ago. Let us call him Georges, 69 years old, a retired former school teacher, grandfather of 4 grandchildren he looked after regularly. He came to see me for what he himself described as an incomprehensible fatigue. He slept 7 to 8 hours each night, apparently. But he got up 3 times, always between midnight and 1 in the morning, then around 3, then around 5, after which real sleep did not really return. The next day he was exhausted. He had difficulty concentrating on reading, which he loved more than anything. He was forgetting simple things. His mood had darkened. His wife told me he had become irritable, which was unlike him. His usual blood panel was perfectly normal, blood pressure well balanced, blood sugar within normal range, kidneys and liver impeccable. And yet Georges was genuinely suffering. When I requested an erythrocyte thiamine assay, which is the measurement of thiamine in red blood cells and is more reliable than serum measurement, his level was effectively below the optimal threshold. Not in severe deficiency, not yet, but in that intermediate zone physicians call functional insufficiency, where the nervous system begins to work with what it has rather than functioning normally. We discussed appropriate supplementation, progressively introduced. 4 weeks later, Georges returned with a smile I had not seen in a long time. He was still getting up once per night, sometimes twice, but far less frequently. And the most important thing for him, when he woke up, sleep returned within a few minutes, rather than lying awake for an hour staring at the ceiling. 2 months later, complete nights of 6 to 7 hours had become common. His fatigue had diminished. His concentration had returned. His wife called me to thank me. I tell you Georges' story not to sell you a universal magical solution, but so you understand what a functional insufficiency in thiamine means concretely for nighttime quality. It is not spectacular in any dramatic sense. It is not a disease with obvious symptoms. It is a progressive and silent degradation of the nervous system's capacity to regulate itself at night. Let us now move to the practical part, because understanding the mechanism serves no purpose if you do not know how to act concretely. And before talking about thiamine itself, I must speak about the most common mistake people make when they first hear about this subject. You are probably wondering whether it is as simple as buying a box of vitamin B1 at the pharmacy and taking a capsule each evening before bed. I can hear you forming that question. And the honest answer is yes, it is almost that simple, but the details make all the difference between something that works and something that changes nothing. The first mistake is timing. Most people, if they take a sleep supplement, have the reflex to take it just before going to bed. With thiamine, this is a timing error. Vitamin B1 does not act like a sleeping pill. It does not induce sleep directly. What it does is prepare the biological terrain so the nervous system is capable of inhibiting itself correctly when the time comes. For this preparation to be effective at bedtime, it needs to have been taken 2 to 3 hours before. In practice, between 6 and 8 in the evening for most people whose bedtime is between 9 and 11 at night. Taken right before sleeping, it can even have the opposite effect of what you are looking for. The second mistake is the form. Several forms of vitamin B1 are available in pharmacies or health stores. The most common form is thiamine hydrochloride, which is also the cheapest and easiest to find. It works for people whose digestive system absorbs vitamins correctly, but for those whose small intestine has lost some of its absorption efficiency with age, which is the case for many people beyond 65, a more bioavailable form like benfotiamine or liposomal thiamine can make a significant difference. Benfotiamine is a fat-soluble form that crosses the intestinal membrane much more easily and arrives in higher concentrations in tissues, including nervous tissue, which is precisely where you need it to act. A study published in Annals of the New York Academy of Sciences compared the bioavailability of benfotiamine versus thiamine hydrochloride and showed that tissue levels were up to 5 times higher with the liposomal form for the same orally taken dose. This is not a minor detail when trying to correct a functional insufficiency in the nervous system. The third mistake is dosage. Here too, the natural reflex is to think that more is better. This is false with thiamine and false with most water-soluble vitamins. The body has a limited absorption capacity, and what exceeds this capacity is simply eliminated in urine. Doses that have shown effects in studies on sleep quality in seniors are generally between 50 and 100 milligrams per day for the standard form, and between 25 and 50 milligrams for benfotiamine due to its better absorption. Always discuss this with your doctor before starting, especially if you take medications for your heart, blood pressure, or diabetes, as drug interactions must be verified case by case. The fourth mistake, and this is probably the most common of all, is premature abandonment. I cannot tell you how many times I have heard patients tell me they tried vitamin B1 for 5 days and it changed nothing. 5 days. As if the nervous system could recalibrate in 5 days after months or years of degraded functioning. Think about what it means to straighten a tree that has grown crooked for several years. You put a stake beside it, you tie it gently, and you wait. The tree does not straighten in a few days. It takes weeks, months, for the wood to resume the right direction. The nervous system works the same way. First signs of improvement generally appear between the 2nd and 4th week. Solid, lasting changes install themselves between 6 and 12 weeks of regular use. A patient I followed, Rosalie, 64 years old, a former nurse who had become a florist after early retirement, once said something I have quoted many times since. She told me that if she had waited to see flowers grow in 5 days before believing the seed had been properly planted, she would never have had a garden. That is exactly it. The seed is planted, the soil is prepared, and patience is part of the protocol. For Rosalie, first changes had been subtle and appeared around the 3rd week. Not that she suddenly slept through the entire night, but when she woke up to use the bathroom, she fell back asleep within 5 to 10 minutes, instead of lying awake for an hour thinking about 1,000 things. This change alone had modified her nighttime quality significantly. At 6 weeks, she was getting up once instead of 3 times. At 3 months, complete nights had become the norm rather than the exception. Now let us talk about the natural allies of thiamine, because it does not work alone and its effectiveness can be amplified or reduced by other factors you control directly. Magnesium is perhaps the most important partner. It intervenes at 2 levels. First, it potentiates the activity of GABA, that inhibitory neurotransmitter that thiamine helps produce. When you lack both thiamine and magnesium, the effect is multiplicative in the wrong direction. When both are at correct levels, the combined effect on nighttime nervous system calm is far superior to the sum of both taken separately. Second, magnesium regulates muscle contraction, including that of the bladder wall. A hypertonic bladder wall, meaning one that is too tense, can send urgency signals for very small amounts of urine. Magnesium helps relax it. Foods richest in magnesium are oily seeds like almonds and cashews, legumes, spinach, avocado, high cocoa, dark chocolate, and pumpkin or sunflower seeds. Vitamin B6 is the second important ally. It plays a role in regulating the synthesis of several neurotransmitters, including serotonin, which is itself a precursor to melatonin. Without a good level of B6, the melatonin production chain can be disrupted even if melatonin itself appears normal. B6 and B1 actually work in synergy in several metabolic pathways, and it is common to associate them in this context. Zinc is the third less well-known ally. A study published in the Journal of Nutritional Science and Vitaminology showed that elderly people with adequate zinc levels in their diet had more favorable sleep architecture, with longer and more stable slow-wave deep sleep phases. Zinc is found primarily in oysters, lean beef, cashews, chickpeas, and pumpkin seeds. There are other simple adjustments that can accompany and amplify this nervous system recalibration work. These adjustments cost nothing and require no prescription. They act on the same mechanisms as thiamine, but through different doors. Stopping screens at least 30 minutes before sleep is not a vague wellness tip. Blue light emitted by phones, tablets, and television screens actively blocks melatonin production by stimulating special photoreceptors in the retina that send a direct signal to the suprachiasmatic nucleus in the brain. This nucleus is the central biological clock. When it receives this light signal late in the evening, it interprets this as daylight and keeps the nervous system in wakefulness mode. This is a real physiological disruption, not an exaggerated sensitivity. Bedroom temperature plays a direct biological role in deep sleep quality. The human body needs to lower its internal temperature by approximately 1 degree Celsius to initiate deep sleep phases. If the bedroom is too warm, this cooling process is slowed and deep phases are shortened. A temperature between 64 and 68 degrees Fahrenheit in the bedroom facilitates this thermal transition and lengthens time spent in slow, deep sleep, which is precisely the sleep during which nocturnal signal inhibition works best. Daytime hydration, and this is a point many people get backwards, should be concentrated in the first part of the day. Drink well in the morning and during the morning hours, continue hydrating until around 4 in the afternoon, then gradually reduce fluid intake from there. Not deprive yourself completely of water, as slight dehydration itself creates sleep disturbances through a different mechanism, but ensure the kidneys have processed most of the fluids before bedtime arrives. Let me be completely honest about one important point. What I'm describing today applies to people whose disturbed nights are functional, meaning related to a poorly regulated nervous system and nutritional deficiencies, without alarming symptoms. If you have burning while urinating, blood in the urine, pain in the lower abdomen or lower back, fever, unexplained weight loss, or if your symptoms worsen rapidly week after week, these are signals your body is sending to tell you something else is going on behind the scenes. A urinary tract infection, a prostate problem in men, a kidney pathology, or other conditions that require medical diagnosis and specific treatment. In this case, the approach I described today is not sufficient and should not cause you to delay a medical consultation. Here is what I concretely propose for you to start. Today or tomorrow, ask your doctor about the possibility of testing your erythrocyte thiamine. It is a specific blood test that can be done at a laboratory on prescription. If the level is at the low end of the range or below, you have a very concrete biological explanation for your disrupted nights, and you have a clear direction in which to act. Before closing, I want to return to something essential. There is an idea that is often heard and that many seniors have ended up accepting as a truth, the idea that fragmented nights are a normal part of aging and one must learn to live with them. I understand where this resignation comes from. When something has lasted for months or years, when you have tried several things without results, it is natural to tell yourself this is your new normal. But this resignation is not grounded in biology. It is grounded in the fact that the right questions have not yet been asked and the right levers have not yet been activated. Sleeping deeply is not a luxury reserved for the young. It is a physiological need as fundamental as breathing or eating. And during deep sleep, the body does things that nothing else can do in its place. If this video has given you a perspective you did not have, if it has helped you understand what is happening in your body in terms other than the inevitability of aging, take a second to leave a comment. Write simply, "I am starting tonight," or a question you have. Subscribe to the Next Stage Health channel and activate the bell. Each week I share practical, precise health information, without exaggeration and without empty promises, for people who have passed 60 and want to continue living fully. I am Dr. Hillman. Take care of yourself and your nights.